This season, Instacart has your back to school. As in, they've got your back to school lunch favorites, like snack packs and fresh fruit. And they've got your back to school supplies, like backpacks, binders, and pencils. And they've got your back when your kid casually tells you they have a huge school project due tomorrow. Let's face it, we were all that kid. So first call your parents to say I'm sorry, and then download the Instacart app to get delivery in as fast as 30 minutes all school year long. Get a $0 delivery fee for your first 3 orders while supplies last. Minimum $10 per order. Additional terms apply.
From the Boston Globe, this is Rhode Island Report. I'm Megan Hall, in for Ed Fitzpatrick. Welcome back to the podcast where we bring you big conversations from our very small state. What happens when a patient sues their doctor for a medical error? A new documentary film, A World of Hurt, How Medical Malpractice Fails Everyone, tells the story of patients and doctors who've gone through this process. It was directed by Brown University medical students and produced by Dr. Mark Brady. He's here to talk about the film with one of the featured experts, Dr. Geeta Pensa. Geeta and Mark, thank you so much for joining me today.
Thanks for having us.
Thanks.
Mark, where did this idea come from? Why did you decide to make this film?
The way that I was always trained in medicine was to read about and try to learn as much as you can about whatever you're afraid of. And it seemed to me that a lot of people in medicine were really afraid of medical malpractice and the medical malpractice system. And so it has this big taboo about it in the medical community. And so this was really just born out of a desire to teach medical students and young doctors what the system is like and how to not let it break you when you're going through it.
Have you experienced a medical malpractice suit?
Not yet.
And what do you say yet?
Because as far as I can see, it's not nothing's 100%, but I'm probably going to have to go through a suit at some point.
You know, there are high-risk specialties and lower-risk specialties, but if you're in a specialty like OBGYN, surgery, neurosurgery, lots of surgical specialties, you can bank on the fact that if you practice long enough, you are going to be involved in a lawsuit, and it doesn't matter how great a doctor you are. And it's become, unfortunately, not a great metric for how good a doctor is.
In the film, you walk through 3 sort of case studies, starting with an example of a patient.
Megan was my younger sister. We were super close.
And this was Megan Barrett, right? And she thought she had a migraine that wasn't going away. And then what happened?
People come in to the healthcare system with symptoms, and she had a headache that was just not typical of her headaches, but she was somebody who gets headaches.
I was very concerned when I heard she was going to the ER because that was very different than any other migraine she'd ever had. We were always able to take care of them on our own. And I had never seen my sister in so much pain.
And they were seen in an emergency department, and they had a scan done of the brain, and the scan was read as being normal by the radiologist. The patient was sent home.
And when I saw that she'd been discharged, I had some relief because I trusted them, and I thought, okay, well, they know what they're doing. So the next morning, I had another text from Megan saying, this migraine never left. I think I need to go back to the ER. It was about midnight, and the neurology resident came in and started asking Megan some questions and asked her, can you tell me your name? And Megan said, 1098-765-4321. And I knew something awful had happened. Sorry.
There was a clot in the brain that wasn't seen or not read on the initial scan that she had, and it was a clear miss from the radiologic perspective. Like you could see it on the scan. And if it was read and if they caught it, maybe things would have been different. But ultimately, this clot in the brain caused a cascade of events, and the patient, Ms. Barrett, died.
And her sister, Amanda, said that things just didn't seem right to her.
I felt I had developed a closeness with one of the nurses in the neurology area, and I asked her, where can I find a public record of the triage policy for the hospital? And she said, I can't answer that question, and because you've asked me that question, I have to notify our risk management team.
The communication just completely shut down. Is that typical of what happens when patients are curious about why something happened, or family members want to understand why someone died?
Lots of physicians now work in larger institutions or for larger institutions now. And one of the first edicts that they hand down when something bad happens and people start asking questions is don't talk. And I think what that does is really immediately sever the physician-patient relationship. And what you feel like as a patient is that your physician just ghosted you. You know, I mean, how could you let this terrible thing happen and then not talk to me and not answer my questions? Like, how could you be a caring human being and do that to someone? And it feels bad from the perspective of the physician too. It feels terrible, but that is how the system works now.
And it sounds like the process almost encourages patients to, or their loved ones to sue because they feel so ignored. That this process of not answering questions, not explaining, not being able to say, I'm sorry, a lawsuit becomes more appealing because patients are looking for closure or answers.
They want answers. They want validation that something bad did happen. And if there was a mistake, they want to understand the mistake. They want to feel like they have some impact over whether that happens to another person going through the healthcare system. And so litigation becomes much more than strictly compensation. It really becomes like, how do I actually get any feeling of understanding closure? And a lot of times these experiences are traumatic. But what we know about trauma is that talking about it, getting answers, processing it is really the only way to heal. And we deny that to everybody.
This lawsuit was exceptionally emotionally draining. I was not as available to my family. It was a full-time job for me for 3 years. I didn't want it to go on. And at that point I realized it doesn't matter what we do. If we go to trial, none of these doctors are going to stop practicing. In the end, their insurance company paid out, and it didn't change anything.
As a physician, I feel like I'm a steward for somebody else's life when I take care of them. To then say when something bad happens, okay, you're not allowed to sit down and have an actual honest dialogue about your decision-making, what happened, what you did next, that you just aren't allowed to have that conversation without lawyers present or outside of a courtroom, or it's madness to me.
You're talking about the toll it takes on physicians. The second case in the film is about a physician who went through this process. I believe he was in Washington State.
This is the videotaped deposition of Dr. Matthew Seaman on March 26, 2019.
Raise your right hand, please. Do you swear or affirm the testimony you shall give in these proceedings to be the truth, the whole truth, and nothing but the truth?
I do.
Well, I read an article that was published by his widow about his case.
Matt always kept me at bay because he knew I would get distressed. So he always said, don't worry about it. It's okay. Things are going along just as they should.
She was willing to go on camera and just talk about the toll that this lawsuit and the whole process took on her husband, who had just retired from medicine and got hit with a lawsuit. The depositions were really harsh.
Dr. Seaman fell below the standard of care in his historical evaluation and documentation of his initial modified trauma evaluation. Do you understand what he's saying there?
I believe so, yes.
And it took an enormous toll on his feeling of self-worth.
So the day of the deposition, he came home about 4 that afternoon. And he said, I felt totally worthless by the end of that deposition.
Nothing further.
This is the end of tape number 3, and this concludes the deposition of Dr. Seaman on March 26, 2019.
And the next morning, I went downstairs to tell Matt goodbye. I was going to go to the medical school to give a talk, and then I found him. He had hung himself.
To have that happen to somebody who dedicated their life to medicine. And he was at, he had finished his career, he was at the end of his career, and to just feel so badly, just it seemed to me that's just very telling that there's something wrong with the system on the other side as well.
And I understand that this is actually not exceptionally rare.
Unfortunately, no. So physicians have twice the rate of suicide of the general population. Now, there are a lot of things that go into that, but we do have data to suggest that civil litigation is a driver of suicide. And I'll tell you that just from my personal experience, and the reason that I do this work now is that being on the receiving end of the ugliness of this, whether or not you feel like you made a mistake, it doesn't matter. The process is so isolating and dehumanizing. I use the word ugly. I think it's the best word to use. And you feel so abandoned. It is absolutely destroying. And so, yeah, it's a driver of suicide.
So what do you say to lawyers or the general public who would say, look, doctors should be held responsible for making these mistakes and they should pay?
They should.
Agreed. Yeah, so if a doctor makes a mistake, they should pay. It's the system of getting from that, which seems, patently obvious, and how it actually plays out that is the issue, and the thing I was trying to kind of dig into with this documentary. Yeah.
I mean, my lawsuit lasted 12 years. I went on trial twice. Something bad happened, but I did not make the thing happen. I went on trial in 2011, and then there was an appeal, and I went back on trial again in 2018. 12 years of my life spent in this unbelievable pit of ugliness.
Do you mind just briefly telling me what happened with your malpractice suit?
Sure. It was a young woman who came in to the emergency department, and she had had a surgery a couple of weeks before that, and she came in with eye pain. I spent a lot of time with her. I imaged her. I did a head CT. I did all sorts of stuff. And then I set her up with a specialist to see them at 9 in the morning. I discharged her at 6:30 in the morning. And between 6:30 and 9, she had a stroke. And working backwards, she had this thing called a vertebral artery dissection, which was back then not something that was easy to diagnose. You would have to get an MRI and that kind of stuff. And she didn't have any symptoms that would warrant doing an MRI. And nobody has been able to draw a line between what she came in with and what happened to her. In other words, there would be no way that I could have diagnosed what she had, and there was no time to intervene in any way to make a stroke not occur in that time period. I had to grapple with that feeling of wait, something bad happened to this patient on my watch. And there was a lot of guilt, and there was a lot of, and what I wanted desperately was to be able to talk to this patient and explain. I feel like, when you hurt someone, or if you feel like you hurt someone, or even if something bad happened and you just want to explain to them, they want to know. And I wanted to talk to her so badly, and I couldn't.
Because of the way the system is set up for protecting doctors and hospitals from lawsuits.
Yeah, because there are lawyers involved immediately. And then that's that.
Let's quickly go through this third case because it alludes to potential other ways to approach medical errors. Tell us a little more about that story, Mark.
The case revolves around a beautiful little girl who was in the hospital.
During that night, her alarms kept going off, her SATs, her oxygen levels were doing something. And I said to a nurse, I said, something doesn't look right. And she said, you know what, let me get the doctor. It was a resident, and he came in. It was dark in the room. He didn't turn the lights on. He didn't examine her.
He brushed it off.
And he walked out.
And she ended up dying, and it was horrible and tragic.
We didn't want a big, huge back and forth with the hospital about pointing fingers and all that stuff, but to have a real open, honest conversation and be able to say, as a family, in the midst of losing somebody that we loved, These are some of the things that were really, really harmful and painful that made the experience worse than it had to be.
Her parents, the Barneses, were in a system that was not so confrontational. They had this program set up where the hospital proactively reached out to them, said, we think something bad happened and we think that we did not provide the best care possible. And we want to sit you down and explain exactly what happened and try to show you that we're making a good faith effort to make sure it doesn't happen to anybody else.
Yeah, I was afraid that it would be more like an us versus them conversation, but it wasn't.
They felt that some of the things that we highlighted in the meeting that we had with them, that they agreed and they wanted to change and they wanted to get better. They wanted to make it better. Yeah. That was like, whoa, they heard us.
So although it was a horrible loss for the family, they were able to start their, their healing journey a little bit sooner than it seemed that other people, if you're going through a court battle for 5 years and you just don't feel any satisfaction at the end of it, it seemed like their journey going through this alternate process was a lot less traumatic for them.
So, Geeta, is this a model for other hospital systems?
I believe it should be. I think, any system like this has its limitations, but what you see as the Barnes' story unfolds, when Mrs. Barnes talks about being able to talk to the resident, which is the doctor in training, who was largely responsible for missing what was happening to this baby. She wanted to talk to him.
And so when that resident walked in, I went over to him and I said, I just need for you to know that it's okay. It's okay. And I need you to move forward and be able to learn from this experience and use it, for the people that you treat in the future. And then I hugged him.
Mm-hmm. And he started crying.
I think that's where healing began for, honestly, both of them, was that ability to really, as human beings, just have this incredible, just this moment where they were able to grieve, like each of them in their own way, but to be able to grieve their roles in this terrible event. And the husband had a different frame, but also rose to the occasion.
Yeah, I have to be honest. I hugged him for a different reason. She hugged him because she wanted to show that love and concern. I had to hug him because that was the only way for me not to hit him. But there's something in me that let me know that this was bigger than me, and I needed to kind of check my emotions and make sure I was being as supportive as possible. And I'm glad I did.
I think that should serve as a model. I really do. And I think it's happening, and some states have more of an appetite for it than others.
So, Mark, what do you hope comes out of this film?
I just hope it can just maybe open up the door for some conversations that could be more healing than the system currently permits. And if some people feel inspired, they can change the system. This is all just based on our state tort law. So if people are inspired, I'm sure there are some good people in the state legislature who could pass some bills and make things better for whichever state you're in.
Geeta, what do you hope comes out of this film?
I just want to say first that I think that they did a beautiful job. I'm really grateful that they showed all of the perspectives involved, and that they led with the patient story, because I don't want that to get lost. I don't want this to be a feeling of us versus them and doctors versus patients. So what I'm hoping comes out of this is that we need to take control of a system that is just fragmenting us. We have the power to do something about it. There are other models out there that work better, and it's time for all of us really to ask for change. This just doesn't serve us as human beings on any front.
Great. Well, Geeta and Mark, thank you so much for joining me today.
Thank you, Megan.
Thanks for having us.
You can watch A World of Hurt, How Medical Malpractice Fails Everyone at ripbs.org. Rhode Island Report is a production of the Boston Globe in collaboration with Rhode Island PBS. I produced today's episode. Audio mixing and mastering by Marissa Ewing of Hemlock Creek Productions. Our music is from APM. Be sure to follow us on Apple, Spotify, or wherever you listen. I'm Megan Hall. Ed will be back next week.